Hey guys, Caitlin here. So last week I was working one of my shifts in the emergency department and I came across a patient who had back pain, which is a very common complaint in any type of medicine, either family practice, urgent care, or emergency department. And in the emergency department, it's very hard to discern what kind of patient needs imaging for their back pain and what patient doesn't. So, the red flags for back pain were created to help guide us in our treatment plan for these patients. 85% of back pain is called nonspecific back pain, or otherwise musculoskeletal back pain that does not involve the spinal column. Now, the red flags of back pain really involve the other 15%, and that 15% really focuses on the pathologic and otherwise life-threatening causes of back pain. So for this video, I want to talk about the red flags of back pain. And the red flags of back pain would require further imaging and treatment after confirmed through that imaging or otherwise diagnostic workup. And the main red flags of imaging are Cauda equina syndrome, malignancy, infection, trauma, and any neurologic changes on physical exam. The first thing I want to talk about is Cauda equina syndrome. And this is one of the things I mentioned in my last video about the 10 most common triads that you will see in the emergency department. So, if you see a triad of lower back pain, saddle anesthesia, and bowel or bladder dysfunction, then you must suspect Cauda equina syndrome and definitely order imaging. Another common symptom of Cauda equina syndrome is severe motor weakness. So if the patient is unable to walk all of a sudden, this is another ominous sign. Cauda equina syndrome is most often caused by a herniated disc, and the treatment for this is emergency laminectomy. The next thing I want to talk about is bony malignancy. And bone, especially the spinal column, is one of the most common places for a metastasis of cancer. So make sure to ask the patient if they have a history of cancer, a current diagnosis of cancer, and then also ask about the symptoms of cancer, like unexplained weight loss or night sweats. Usually solid cancers like prostate, lung, or breast cancer, and also multiple myeloma have the capacity to metastasize to those bony columns in the back, causing that back pain that we are talking about. The next thing I want to talk about is infection. And osteomyelitis, which is a bone infection, most often presents in the vertebral column in adults. So make sure to ask about fevers or chills, IV drug abuse, if the patient has had a recent LP, spinal, or epidural, or if they are immunocompromised. And if they have any of these risk factors, make sure you order imaging for possible osteomyelitis. The next to last red flag I want to talk about is if there is any neurologic changes occurring. So if the patient is complaining of any numbness, tingling, paresthesias, or paralysis. The nerves from the spinal cord splay out from the spinal column. So if there's any pathologic changes going on in the spinal column, the nerves will be the first to let you know. And we know that preserving any, if at all, nerve function in the spinal cord is very important. The last red flag for back pain that I want to talk about is any signs of trauma. So if the patient has back pain after a motor vehicle accident or they've fallen down the stairs. And there can be many different types of fractures in the spinal column that may or may not need surgery, and we will only know if we get imaging on the back. Fractures in the spinal column are definitely more popular with certain populations, especially if they have been diagnosed with osteoporosis. The obvious risk factor here is age, but please do not forget about patients who are on long-term steroids or they are chronic smokers or chronic alcoholics. They are definitely at risk for premature fractures. And then please do not forget about spondylolysis and spondylolithiasis, which is more common in athletes or specifically gymnasts. A good acronym I like to use to help me remember the red flags of back pain is called Tunafish. T standing for trauma, U for unexplained weight loss, referring to cancer, N for neurologic symptoms. A for age greater than 50, referring to the risk factor of trauma or a fracture. F for fever, referring to infection. I for IV drug use, referring to infection or osteomyelitis. S for steroid use, which is another risk factor for a fracture. And H for history of cancer metastasizing to the bone. And that's it, guys. Just remember, imaging technically isn't needed for most cases of back pain, since the most common cause is musculoskeletal. So if you follow these red flags, these will help guide you in your treatment plan when a patient presents with back pain. See you next Wednesday, guys.